Hey there, Devin McWhirter. I'm a paramedic with the Fire Department, and I'm going to talk to you about burns today. So I'm going to try to keep this real simple because sometimes these things can get kind of complicated. So there's 3 layers of burns. There's the first degree burn, second degree burn, and a third degree burn. And they made it real simple by just making it compatible with the 3 layers of the skin. So you got the epidermis, which is just the normal skin layer. And then we have the dermis, and then below that is the fatty tissue. So first degree burn is just the skin, it's just the top layer there. It's fairly minor, not too big of a concern, but when we start getting into the second degree burns and the third degree burns, that's where we have a problem. The second degree burn is an issue because in the dermis we have hair follicles, we have capillaries, blood vessels, we have glands, nerve fibers. All these things are important obviously for the body, right? So when we start damaging those, that's when it becomes a problem. And then down into the third degree, the fatty tissue and even into the bone, that's even a bigger issue. Treatments are actually fairly simple on the first degree burns because the skin layer, it's sunburns, that kind of thing. So really just keep it cool, keep these things covered. You can use kind of a cold cloth, gauze bandage. It's not going to harm it if you want to put like an antibacterial cream or something, but keep it real simple. It's going to heal on its own if you just keep it clean and make sure it doesn't get infected. Now the second degree burns and the third degree burns is where you're going to want to see a doctor for these. They're much more complicated. So if you get one of those, keep it covered. You can use a cool compress or just keep it dry and covered and get to a doctor because there's going to be much more treatments going to be needed for that and pain relief. What we don't want to do, there's a lot of these things out there. We don't want to put butter on any of these burns or honey, even ice. We do want to cool the skin. We want to cool the burning process, but since the skin is damaged, if we put ice on it, we can do further damage by doing that. So avoid ice, just keep it cool, and then get to a doctor. That's pretty much all I got on the burns. As always, your safety is our priority.